You're listening to the Unlocking Africa podcast.
So generally, I work within the space of taking AI and applying it to real-world problems. I think I just learned Java and Android development, and I wanted to build something. So I was like, hey, why don't I build a translation app? There was a research that shows that if we want to achieve universal health coverage by 2030, we will need 40 million additional health workers. 40 million. Is that knowledge gap that exists of understanding the regulatory landscape and the requirement of building within the digital health space.
Stay tuned as we bring you inspiring people who are unlocking Africa's economic potential. You're listening to the Unlocking Africa podcast with your host, Tessa Adamu.
Welcome to the Unlocking Africa podcast, where we find inspirational people who are doing inspirational things to unlock Africa's economic potential. Today, we have Darlington Akogo, who is founder and CEO of minoHealth AI Labs. minoHealth AI Labs uses artificial intelligence for automated diagnosis, forecasts, and prognosis for various medical conditions. Welcome to the podcast, Darlington. How are you?
Thank you for having me. I'm well. It's been an interesting week. It's been fun, but also quite stressful. How are you doing?
I'm very well, thank you. And it's a pleasure to have you. Hopefully we can find out a bit more about what's been happening in your week during our conversation. So, as always, I like to start from the beginning. So I was hoping you can give us a brief introduction into who Darlington is.
Yeah, so I'm Darlington Akogo, founder CEO of minoHealth AI Labs, and then a couple of other companies within the space of AI. You know, there's Caragro AI focused in agriculture. There's Kudra AI, which is broadly looking at AI for enterprise, and then also Ranmila AI Institute, which is looking at AI for education. So generally, I work within the space of taking AI and applying it to real-world problems. So it's real-world AI, specifically nowadays, mostly focused on generative AI. I also do research. So a lot of the work that we do sits between taking research and then translating it into real-world applications. I am also an educator, so I do quite a lot of stuff when it comes to AI education, both in academia, serving as a PhD co-supervisor right now between a joint initiative between Imperial College London, University of Ghana, and then minoHealth AI Labs. So we have a PhD fellow that is focused on AI for biomedical science. I do also work on AI governance. So I'm currently co-leading Ghana's national AI strategy, working with the Minister of ICT. But then I've done a lot of work in AI governance for United Nations. I worked on the African Union's continental AI strategy, among a number of things. So basically all things AI, all things technology.
Darlington, it's clear that you're fully embedded in the world of AI, but I was wondering, is there a specific moment that sparked your passion for AI?
Yeah, so growing up, I was one of those nerdy kids that was into sci-fi. Well, I think right now everyone is into sci-fi. It's kind of cool to like sci-fi, which means that I watched all the cool shows, the cool movies that had robots in it. They had AI systems in it. And I was also a technologist, or at least I had passion for technology. I wanted to figure out how every device worked in the house. Tried to figure out how the TV worked. Unfortunately, ended up burning the house one time accidentally because of that. Exactly. And if you're a technologist and you like to build stuff, one of the ultimate things you can build is AI, because it's like the most complex thing that we know around us as humans, right? The way our brain works. So if there's a way you could capture that in digital form, that is the ultimate goal. So yeah, that has been a dream. And over the years, that manifested into different things. So I got into computer programming 2010 at the age of, I think I was 15. Then a couple of years later, I decided to get into AI. My first attempt into AI was I got these books in what they now call symbolic AI, and the book covered how to build the symbolic AI systems using Java and Pascal, which was horrible. So I lost interest. So this would have been around 2013 or 14. Then about a year or two later, I rediscovered my passion for learning how to build AI systems when I started embarking on a project in healthcare, which is I wanted to create a system that will address the fundamental challenges that existed in healthcare. And so that led me into neural networks, deep learning, and all the cool stuff that have been around today. So yeah, basically, first attempt was 2015. Then I think I lost the laptop I was working on with no backup. I lost all the data and I was brooding over it. So I started again in 2016. By 2017, I was ready. I registered in Ghana, and then that was the first time of kicking what basically were projects I was building on my laptop and now bringing it into the real world. Yes.
Fantastic. So yeah, that was going to be my next question in terms of from being a nerdy kid into sci-fi and technology. How did that actually evolve into creating minoHealth AI Labs in 2016?
Yeah, there were different points with that story. So like I started coding in 2010. I just like jailbreaking phones. I hope that the legal boundaries will not let any phone manufacturers come after me. This is like what over 10 years ago. But I just enjoyed like pushing the limits of phones. So things like if you have an iPhone, can you get it to run both iOS and then Android OS? If you have back in the days, those Microsoft or Windows phone, can you run like three separate OS on it so that you get to have everything? Or can you go find like a version of Android that has different features that is not officially from Google? I like doing stuff like that. But all of it kind of started because a friend of mine had BlackBerry, and then he was like, oh, I'm going to pay someone to upgrade my BlackBerry for me. And I'm like, why would you do that? That's too easy. And it's like, no, it's super complex. The only few people who can do stuff. I'm like, psh, bet. So I took his phone and then, back in those days, you go to the internet cafe. So I went to the internet cafe to go like, download all the OS and jailbreaking tools I needed. And I jailbroke his BlackBerry and installed like a version that officially BlackBerry was not supporting on that phone. And everyone was blown away. And so this became a thing where there used to be a platform, Google, I've forgotten what it's called, but it allowed you to sell services and goods online. So a lot of people started demanding my service. So I placed it here. So people I don't know would actually show up to like my school, hand me their phone and say, oh, I want to have this OS on it. So I want to have this. And this was like a business I was running on the side and charging people for it. But then I was also building websites. So I learned how to do front end, back end web development. So I was building websites for people. And the funny thing was I was in high school at this point, like 15, 16. But then I did not look my age at all. I looked quite grown. And so I would wear suits and everything, show up to companies and be like, oh, yeah, I run this software company and then we can build you a website. And then they'll be like, oh, how are your wife and kids and stuff like that. They thought I was like a full-blown adult. I had a deep voice, even deeper than now. And then I had like mustache and everything. So yeah, it started off in those direction of building a website, jailbreaking phones, and then that evolved into building an app. So I think when I was 17, I built an app called Tree Translator. It's basically the first translation app built in Ghana. And I had close to, about 100,000 downloads. I think I probably had the most downloaded app back then. It was so funny because by then I had relocated to Italy and I would randomly meet like Ghanaians, and they'll be like, oh, Ghanaians are doing impressive stuff. Like some Ghanaian built this app called Tree Translator. We've been using this amazing. I'm like, yeah, I built it. They're like, no way. So there were people using my app, and then they didn't even realize it was me because I didn't even put my name there. My sister was in Switzerland, had the same experience. Someone came to me and be like, yo, Ghanaians are really amazing. There's some Ghanaians that have built Tree Translator. I was like, yes, my brother, like he built it, staying up all night and stuff like that. Yeah, so all of that then translated into minoHealth eventually in 2017. And of course, then from minoHealth, it then expanded to Cara, Grow, Goodra, and all the other entities too as well. Yeah.
Thank you for sharing that. In the early days, I guess you face a lot of skepticism about how AI can actually truly transform or enable some of the things we are seeing now in healthcare. I was wondering, how did you manage to turn that skepticism or those challenges into the opportunities that you are creating today?
You're right. To be honest, getting into AI was the toughest thing I did, especially in healthcare. So, mind you, Tree Translator, for example, it took me a couple of weeks. I think I just learned Java and Android development and I wanted to build something. So I was like, hey, why don't I build a translation app? And today you build translation apps using AI. Back then it was just a lookup table, right? So you put in a word, it will search through the database and then match it for you. But people, like, it was impressive for its time. And it took me basically weeks of doing this. I got 100,000 downloads. I didn't need to put in much effort. I didn't do any marketing. That's like, I just put it online and then shared it on social media, and people were using it, knew nothing about me. So coming into healthcare, I thought it was going to be the same. I was just going to build an AI system, put it out there, and then sit back and watch the magic happen. It doesn't work like that in healthcare. Like, hospitals don't just randomly pick stuff on the internet and start using it. Like, you have to deal with regulations, you have to deal with data protection laws, you have to deal with the health regulators in individual countries, you have to do a lot of clinical validation, you have to publish papers, you have to do all of this. And so, to answer the question of about the skepticism, there is healthy skepticism that comes, especially in healthcare, because you're dealing with human lives. But then also sometimes that can morph into cynicism, where people just shun new technologies or anything that disrupts the status quo. So I had to deal with this because mine was 2017. I relocated from Italy back to Ghana, and I'm
Yes.
going to hospitals. You know, back then I had dreadlocks, and I was living life. I used to wear like basketball shorts to meetings and stuff like that. So imagine you run a hospital and this guy shows up in basketball outfits with dreads, talking about, yeah, I have this system that can help you diagnose people. Well, I'm like, get out of here. Like, so yeah, it wasn't helping. So I needed to clearly rebrand myself. I needed to also change. And then you see, healthcare is also about trust. So a lot of questions back then is like, okay, are you a medical doctor? I said,
Yes.
no. Do you already work with any health institutions? Like, no, it's just something you don't know. Like, no, we don't trust you. So we had to actually then morph into a research entity that were putting our research papers internationally, and then eventually started collaborating with top universities like Imperial College London, Oxford University, working with UN organization, WHO, and all of that, publishing papers. And then so that builds the reputation, and then you kind of expand on that to now start doing implementation. So right now, for example, if there's a new hospital that I walk to, even a new country, because right now we are partnering with governments in different, not even just in Africa, in different parts of the world, in the Caribbean and all of that. So if you walk into a new country and then they see you, whatever the skepticism is, you can be like, oh yeah, these are several papers we've published on several research on our AI system. This is implementation of the AI system. This is it being used in these facilities for all these use cases. So then you overcome all of those. But yeah, where basically we are now, that took us several years. If you had asked me at the start of it, I would have told you, yeah, it would have taken me 7 months, and 7 months became like 7 years. Yeah, so I had no idea how tough it was going to be. And then the technology itself it changes a lot, right? So building a translation app required me coding. Building AI systems is quite tricky. So it's kind of a mixture of science, but also arts and alchemy. There's some alchemy involved in it. So you
Yeah.
get a bunch of data, you pick some algorithm that you've created, and you throw the data against the algorithm and you run it on some compute over some period. And you are not sure exactly what you get at the end of it until you are done. And when you're done, especially with generative AI systems, you might get a bunch of things you were hoping for. And sometimes you get things that you didn't even realize were in there. Right. And sometimes some of the things you were hoping for. So you have to build a lot of intuition for it. So which has been helpful because I've been training these systems for about 10 years or so now. So I've built a lot of intuition for it. But there's a lot of unsolved technical aspects to AI, especially generative AI. And then now that we're basically working towards what we call artificial general intelligence. So working on the very edge of a technically complex domain like AI and then applying it to one of the most complex, highly regulated space like healthcare, it's no easy combo.
It doesn't sound like it. So looking back in terms of the challenges and how you've built your reputation through research, what were the key turning points that convinced you that AI could truly make an impact in healthcare delivery in Africa?
Yeah, I would say, I don't know if there was one point. I was always a believer, right? So I recently was listening to a journalist talk about AI and the people in it, and they said it almost sounds like a religion or a cult. And I had all the description they gave, and I was like, that's normal, but that's also a sign that you're in a cult. The only people who think cults are normal are the people in it. So so then that was like a red flag to me. No, it's for me, it always made sense, right? Because the major issue we have in healthcare, infrastructure is one of them, but the other one is that we have a shortage of clinicians, right? And if you have a shortage of clinicians, the obvious solution is to just get more clinicians. But medical school takes like 6 years. And then you have to, from that 6 years, you don't all of a sudden become an expert, especially if you want to become a specialist. There's so much barrier to entry, and our population is growing faster than we can train the clinicians we need. There was a research that shows that if we want to achieve universal health coverage, by 2030, we will need 40 million additional health workers. 40 million. I did the calculation, it will cost us several trillions of dollars annually to pull that off, right? We're already spending, I think I checked the last time, about 10, 13 trillion dollars annually on healthcare globally. And we are supposed to be adding several trillions more. So it will cost the world. And even if you had the money, finding the people to do all of that. So if you can have an AI system, the good thing about digital things is that they scale, right? If I have a bottle of my favorite beer in front of me, right? If I wanted to make it 100 bottles of beer, it doesn't happen instantly, right? Someone has to make those additional bottles. But then if I have an app, right, and people like that app, it can be an app on a single phone to an app on a million phones in an hour. And basically, it costs me next to nothing. Once they download it and run it on their phones, it scales easily. So AI is digital in that sense. So if we can take aspects that there are gaps in healthcare, turn them into AI solutions, which are digital, basically you can have clinicians in everyone's pocket on the planet instantly. You can do that. So to me, it was obvious, but then it's easier said than done, right? So you have to
Yeah.
build those systems. You have to put the right guardrails into those systems. And then, of course, like where we are now, it's not the AI systems going off by themselves and being your medical doctor. They have to be an assistant to the existing medical doctor. So how do you integrate it properly into the workflow of doctors? Those are all the things. So I was always a believer The challenge was making sure the technology evolves rapidly towards this sweet dream that we can have healthcare in everyone's pocket.
Fantastic. So I guess keeping on that theme in terms of how you see AI and human expertise complementing each other, we know that access to affordable care is a major challenge, such as I think I read the ratio of one radiologist to 800,000 patients in Ghana. How is minoHealth hoping to bridge this systemic gap?
Yeah. A couple of years ago, we built an AI system where you can upload, say, a chest x-ray, and then the AI system will tell you whether that chest x-ray is healthy or diseased. That was a starting point. Then it evolved into the AI system telling you if it is disease, there are 14 different chest conditions, which of them are present, which of them are not. Then we went further, and instead of just saying a condition is present or not, we'll show you where it is located on that chest x-ray. So we'll draw a box around it. So if the heart is too large, the AI system will draw a box and tell you that is cardiomegaly. If there are nodules or masses, the AI system will pick it up. But that was not the final point, right? Because what happens in health facilities is that health workers write medical reports. Clinicians write medical report. They don't draw boxes on medical images. So even though that was helpful and we worked with FDA Ghana to get pre-approval, which essentially means our AI system was the first standalone AI system to get health regulatory approval within Africa. We did this, I think about 2 years ago. But then we were always looking at how do we further build the technology. So that takes us to where we've gotten to now. We built a generative AI system called Moremi AI. So Moremi AI, instead of handling just one or two modalities, can support over 30 imaging modalities. So it can process chest x-ray, mammograms, it can process CT, MRI, angiography, and then even outside of radiology, we can do microscopy. And so the AI system, ECG, all of those things, lab test data, genomics, even beyond imaging. And so now the AI system actually generates reports. So you give it an image and it will write the text, the reports, in the language, in the tone, with the nuances that a medical doctor does it. But this is a draft. So it's basically the first review, the preliminary review, and then the clinician can take it, review it to see, do they agree with the AI system, which point do they not agree with the AI system, they edit it, and then they can send it. So this is the base, but then the AI system has evolved and we are doing a lot of things. So screening, diagnosis, treatment planning. We've expanded our work even in biology. So we are doing drug design, drug repurposing, and several things. All built mainly on top of one AI system, which is the Moremi AI.
So, from what you've described, it seems like the AI that you're deploying is involved in the full customer or the patient journey. So, how do you balance the innovation with also, I guess, the ethical considerations and patient trust when deploying AI in healthcare?
Yeah, so there are different things you have to do. The starting point is understanding the regulations and ethics that guide the space. So we're talking about handling data and then AI, and then also even more precisely healthcare. So data protection laws, you have to abide by them. You have to look at things like personal identifiable information. How do you make sure you're not exposing anyone's personal identifiable information? We don't even train the AI system with personal identifiable information. So those are some of the things that you have to look at. And then you have to look at privacy, you have to look at security. And you build those reputation over the years, right? So as you're implementing with different partners, you exhibit that, okay, this is at the center of your focus. How do you deploy AI system? What are the guardrails you're also putting in place? So there are certain specific things we do. For example, when our AI system generates a report, until a clinician reviews and signs off on it, you can't download the report out of the system, right? So those are ways to maintain guardrails, because you don't want a scenario people are like, oh yeah, the AI system said it, so end of discussion. But no, we know the limitations of the AI system. They're really impressive. They can detect certain things that even from our tests, human clinicians can't, but also we've seen them miss things that human clinicians easily find. So it's a combination of both that lead to better outcomes. So there are all these things that you put in place to ensure patient safety and privacy. And based on that, you then build the trust from patients. Yes.
Welcome to Verto Corner, brought to you by Verto. Today, we're diving into why speed and FX transparency are now deal makers, not just nice to haves. Here's Twanda Mudimbu, Sales Director at Verto, to discuss how customer expectations are shifting across Africa. Over to you, Twanda.
Hi, everyone. Good to be here, and thanks for the question. So, as was mentioned, I look after a commercial team here at Verto. We are a cross-border payments company focused on business-to-business money movements, with a focus on Africa and the Middle East specifically. We help businesses that are looking to move money across borders within Africa, outside of Africa, or into Africa in a way that is efficient, is cost-effective, transparent, and fast. We've built this through a number of initiatives over the last few years. We're a tech-first business, so essentially our solutions are delivered to our clients through our technology platform. But if I take a step back and look at the landscape and what the problem statement really is here, a lot of businesses that we engage with face the same problem, right? They're running good going concerns and are looking to move money from point A to point B. It sounds fairly simple when I say it that way. But the bottlenecks that they encounter while trying to do this are kind of crystallize themselves into a few. One, there is a lack of transparency about how you can move money across borders. Two, how long does it actually take for you to move money from that said point A to point B? And three, the cost of doing so, and a predictable cost of doing so. We are focused particularly on business-to-business payments, like I mentioned. But if you take a look at some proxy data, the cost of remittances into Africa sits at anything between 7 and 9%, depending on what data you're looking at. That's contrasted to kind of a global average of around 6%. There's a bunch of different types of reasons. One, it's the cost of the actual FX, the cost of actually converting currency, and the costs that are bedded into that process ordinarily through traditional banks and money brokers. At each point in that network, there are costs layered on top of that. That then means that there's also additional time taken for your money to settle to where you want that money to get to. On average, we see anything between 3 and 7 business days for businesses to move their money across borders. And oftentimes, this is even intra-Africa. So for you to move your money from Ghana to Kenya, for example, 3 to 7 business days. Layer on top of that, the costs that I've just mentioned, and the whole process starts to become very inefficient and prohibitive for businesses to scale and to grow. Another interesting data point is that you've got the UN SDG goals, and one of those goals is, I think, a 3% cost of transaction for exactly these types of payments. That's 3%. We are at 7, 8, 9%. So there's a huge gap, even just taking that metric, that needs to be solved for. So the problem is clear. The pain is felt in real terms on the ground. What can we and what are companies like ourselves and what did we at Verto built? Our way of working on a day-to-day basis is simply put to try and engineer that cost down from 8, 9% all the way back down towards those intended goals of 3% from the UN, and actually collapse that even further. And also the speed and the transparency associated with moving money from point A to point B. What have we built? We have built a API-driven platform that allows us to offer our clients and our partners the ability to move money quicker, cheaper, and a lot more predictably across borders. We call it our Virto Atlas product, which is an enterprise level solution where companies can integrate into the infrastructure that we have built that allows them to facilitate these payments through our rails, essentially. And why would someone do this? Why would a business of whatever size take the decision to do so? What we have built is competitive for the following reasons. The infrastructure that we've built, where we have integrated our rails with multiple different banking institutions across different jurisdictions, not only in Africa and the Middle East, but globally, allows us to move money a lot quicker. Using a platform like ours completely removes that burden from yourself. We carry that burden on your behalf and are able to facilitate these payments on your behalf. That's the first thing. The second thing is what we do is we know exactly who we're working with. We know exactly how your money is going to be moved from point A to point B. And so you as a business owner, it can rest assured that you're not going to end up in a situation where maybe, you're dealing with a third party that doesn't deliver on the payments that you've given them, or from an AML and KYC perspective, you are completely above board. You're not touching or associating yourself with any sort of illicit funds. All of that is completely transparent and known on our platform. And then also, which is a big consideration for a lot of businesses, is the cost of actually doing these transactions. We have built efficiencies and cost savings into this process that makes our products for our customers not only efficient and easy to use, but in many instances, a lot cheaper as well. So you're saving on the costs, you're removing the complexity of moving this money. The upside of that is that you're not spending a lot of time trying to figure this stuff out yourself. And then obviously you have a reliable and repeatable way of making these payments on a daily, weekly, monthly basis, whatever cadence you need to make these payments through our platform.
Thank you for that, Tawanda. You touched on the key challenges that businesses face with regards to FX and settlement, but I was wondering, what are the key factors that usually get, say, a client to leave traditional banks for Virto?
Yeah, sure. So the first thing that we have built and we've been very deliberate about doing is, we have a process, an experience, and a product that is intuitive, it's easy to use. You don't have to have multiple degrees to be able to understand how to use it. It's digital. So you're not having to go and queue in banking halls and physically get yourself to a place where you can execute on these transactions. That's particularly important for, super busy business executives that are trying to actually run a business on a day-to-day basis and don't want to have to spend their times or their staff time dealing with going into banks and all the admin that comes with. So I think that's one thing. It's a simple kind of convenience thing. The second element of it is the reliability of our systems and the predictability of our systems. If I can tell my clients and my partners that we can guarantee you that your funds will settle where they need to get to globally, T+1, that means on the next business day, that is impactful to a business. If you compound that over a 12-month period for a business, for example, that relies on cycles, you're able to execute multiple more cycles during the course of a 12-month period simply because those settlement times have been halved or more in many instances. And that's real impact for your business. And then the third aspect of it is the cost element. How much is this actually going to cost me? We can have conversations with our clients about how we can save them money in executing these transactions, whether that is a business that is looking to move money intra-Africa or looking to move money outside or get money back into Africa. And we can actually save you, one, on the FX, and two, also on those correspondent banking fees, which eat into your margins, and that is all kind of collapsed by our platform. Then it's a compelling business case.
Thank you to Tawanda for showing us how the game is changing in African markets. If you want to learn more about faster settlements and transparent FX with Virto, check the episode notes for links and more. Join us next time on Virto Corner. And now back to our interview. You touched on understanding AI regulations, which are often driven by policy. We know that you've worked with institutions like Imperial College and the AU on AI policy. What would you say is the importance of global collaborations such as this in terms of scaling African-led innovations?
When it comes to AI governance, especially within the space of AI for health, so there's one group, which is the United Nations Global Initiative on AI for Health. So I served as the chairperson for the topic group on AI for radiology since 2019, I think, 2019. And what we did as part of this group was essentially we wrote the blueprint for AI for health regulation globally. So what the work we did has been adopted by FDA, US, NHS, EMA, and all the major health regulators around the world. Because I mean that's basically what the UN is for. You come up with frameworks and then they are adopted by member states all over the world. So yeah, spending several years within this, working with brilliant people from across the planet. So we are talking about working with folks that are experts in governance, folks that are experts in technology, in legal things, in research, all in healthcare, all of it combined. Within the span of that project, we basically traveled to almost every single continent on the planet. We visited some key countries in there, some key cities, worked with the government, worked with the local ecosystem. And it's very essential to do this because there's a phrase in Ghana we use called local champion, right?
Mm-hmm.
I'm so anti that, right? So you don't want to be the person who is like, oh, yeah, in just your neighborhood or which is technically your country. Everyone is impressed by what you do, but on the global stage, you are so far behind and not really competitive, right? You want to be the best across board. So the only way you become the best across board requires it's like game theory. There's a lot of collaboration, but also competition that needs to happen. So you need to look at what other people are doing in other parts of the world, collaborate with them, learn from them, and then other times you compete with them and beat them. And so from the very start, I was ingrained in what we did. We were not interested in being bottled or seen. We are proud Ghanaians, we're proud Africans, but we didn't want to be seen as, oh, this is a global stage of AI, but then you are on this other side that we've created this small space for you to sit in and say you're doing AI in Ghana. So yes, we're doing AI in Ghana, but we're also doing AI globally. And the ways to do that is through collaboration, but it's also when the time comes for you to compete and outdo people internationally, you have to show up and prove that.
So, with these collaborations and also being able to see what people are doing on the global stage of AI, what would you say Africa's AI future looks like?
Well, it looks good. Take, for example, when I started in 2015, 2016, modern day AI system, which is neural network deep learning, was new everywhere in the world. I think that was right around where Google DeepMind was created. A number of AI companies we celebrate today did not even exist back then. Anthropic and the rest did not exist. So basically, we started right around the time where some of these other companies started. And so AI was still a niche. And one of my concerns was that I was on an island alone and no one was there at least close to me that could understand. I remember we did an AI event in 2018 and only 5 people showed up. There was no interest even in the tech community in Ghana in AI. All right, so we went from there. A couple of months later, we did an event again, and so many people showed up. A lot of people said they were interested in AI. And then over the years, we saw the community blossom. I remember going to South Africa, participating in some events, and then meeting other people that were also building AI solution. And now there's AI communities in all major cities across the continent. And they're doing research, they're building startups, they're doing all of this stuff. We just did the Global AI Summit in Kigali. That was a month ago. And this was massive. You had every country being represented. You had government officials, they were there. And collectively, the governments committed several billions of dollars that they wanted to allocate towards AI in Africa in the coming years. So it's the space has grown quite a lot. But there's also the challenge of maturity, right? So there's a lot of young mushroom initiatives that are cross board, but the limitation around skill is resources, right? So I mentioned that there were companies like OpenAI, Google, and the rest that were started around those times. But look at the resources that have gone into those institutions, right? OpenAI currently is valued at $500 billion, or they are selling their employee stock options, they are selling shares to investors at a valuation of $500 billion. That's $500 billion, right? And the amount of money that has been pumped in, several tens of billions of dollars. The access to capital is not the same in Africa. And so it's good that we have the early stage covered, right? There's a lot of AI developers, AI communities, AI startups, AI training institutions. And even on the governance end, several African countries have national AI strategy initiatives, right? Or AI governance initiative. Like I mentioned, I'm co-leading Ghana's National AI Strategy Initiative. Nigeria published theirs not long ago. You have Uganda, Kenya, Mauritania. You have several of these countries that have initiatives. So the next stage is, how do we take AI initiatives and then go beyond areas of skill, which is one of the things that we are focused on. So basically, that's why we are doing a lot of partnerships on the government level. We are working towards scaling. But then also access to capital is essential to achieve that. And that's one of the limitations currently, yes.
Yes, I guess in order to cement the future, we need to train people and bring them into the ecosystem. I think you founded Runmiller AI Institute to train Africans in areas such as machine learning and AI technology in general. So I was wondering specifically with that, how have you seen young people on the continent responding to these type of opportunities?
Oh yeah, we've done a lot of training programs in Ghana, in Nigeria. We just actually completed some training programs in the Caribbean in partnership with Eastern Caribbean Central Bank and then the Ministries of Education of 3 to 8 of the Caribbean islands. And it's amazing seeing young people going from not knowing anything in AI, learning it, to just building amazing stuff in AI. So, and even now, for example, as part of the AI strategy, and this part is already being implemented in Ghana, there's the 1 million coders initiative. So government is in the process of training 1 million developers in Ghana. And then part of the training would cover AI and everything. So that's one of the areas, creating the skilled labor to be able to take this space. So I think we are doing a good job. We're on the right track. This is happening in different pockets of the continent. Yes.
Fantastic. So you touched on the training aspect. So if we can go into that further in terms of how do you see investment in areas such as digital health solutions shaping not just healthcare, but also the job creation in Africa with regards to AI, machine learning?
Yeah, so it's going to be massive. Basically, what is going to happen is that you are getting a new crop of clinicians who are trained to be AI powered clinicians. So, as part of one of the government scale up initiatives that we are doing now, it would involve training clinicians, massive training of clinicians across an entire country. That's what we are going for. And you, to make it scalable, you use models like training of trainers so that you are not manually or trying to directly train every single individual, but you want some cascading effect where you train a group and then they go train more, and then you get this sort of like pyramid. But this is a positive pyramid scheme, not the bad kind. So, yeah.
Fantastic.
Yeah, so those are some of the things that, because basically what happens is this: if you're a clinician trying to do everything by yourself, it takes forever. How long does it take a radiologist to review and then write a report. For complex modalities, it could take you an hour or several hours, depending on how overworked you are. And then if it piles up, then basically you have a backlog. There is one partner that we engage with, and they have like a 3 years worth of backlog. It's because they are being overwhelmed. And so there are all this lives that they want to see their report. They want to see are they okay or not, and then there's a backlog. But with an AI system, with our AI system currently, Moremi, you can get a report generated in 5 seconds. So what happens is that the clinician is then empowered. If you have all this backlog, you can just use our AI system to help you clear the backlog, make your life easier. So you are basically making it so that a single clinician moves almost like an army. So they are one person, but they are working like they are 30, 100,000 people. And most of it is they having these AI agents that are basically assistants of theirs. And then they can assign them to do different work. And then they get to manage and then control all of this.
We've touched on the positives generated from investing in areas such as digital health. But if we look at it from a different perspective, what would you say are the barriers that still exist for African youth who want to enter AI and digital health innovation?
So I'll probably separate them. So on AI, I really don't think there's any barrier currently because you can just join our training programs from Miller. There are also a bunch of free online courses you could just pick up by yourself, learn it if you have the dedication and the passion. There's too many options. You learn it, and then if you want to build some AI systems, you can build them. You build a couple of basic ones, you grow your skill sets. And the good thing about the AI space and let's see those digital spaces that we don't choose people based on academic qualification. We choose it based on what you've built, right? So a lot of people in AI were not trained academically in AI. They were either trained in some other field or no one even cares about that part. It's like, okay, what have you built? So a lot of the people that are on my team, literally no one on my team was trained academically on AI. Let me put it that way. Everyone either studied something else and then by themselves they learned AI, or AI was like a course in their school, but the course was terrible to begin with. It never even actually looked at modern day AI. So it's so easy to get into AI. Probably maybe the barrier will be compute, but that's only at the scale up phase. So if you're just getting started, there's so many free resources that you can build small scale AI systems on it. Now, if you wanted to scale up those AI systems, you need a lot of GPUs, you need a lot of cloud compute credits, which can get really expensive. So that would be the barrier. But the barrier to digital health is that because it's healthcare, you can't just build things and throw them out there, right? There's the famous move fast and break things ideology in tech. It doesn't really work in healthcare, right? Unless you're building something that is not involved in the healthcare delivery pipeline. If it is involved in that, then you have to go through some steps. And a lot of young people are usually not aware of those steps, right? So they are not aware of the fact that you need to look at regulation, you need to look at data protection, you need to look at clinical validation, you need to publish all this, but they're not aware of that. So they assume that, oh yeah, I'm just going to build something and put it on the app store and people are going to download it and then that's it. But even if that happens, you might be breaching so many laws that you might run into issues. So is that knowledge gap that exists of understanding the regulatory landscape and the requirement of building within the digital health space. For example, if you're building EHR, you still need to comply with a number of regulations. So you never really skip some of those things. But I mean, there are a number of accelerators, incubators that are emerging on the continent that are helping young people to address this. I was just with some group, I think about a month or two ago. This was a group put together by Africa CDC and GIZ, where they had some young Africans taken from across the continent as part of a fellowship program in digital health. So those are young people that are starting digital health initiatives, and it brought them together to train them on the technical aspect of it, but also on the healthcare, the regulatory aspect of it. So, and then I did some sessions with them to just share some of the lessons learned and everything like that. But yeah, we need more of those initiatives.
Thank you. So you touched on regulation again. So what message would you give to, say, policymakers about ensuring youth-led innovations in Africa get the support it deserves?
Yeah, so you don't want to. The thing about regulation is that at its best, it protects lives, it protects all of us, it minimizes danger. But then at its worst, it stifles innovation, it stifles progress. Striking that balance is very delicate, especially for emerging field, because you have to sort of uh, forecast into the future to say, should we allow this or shouldn't we allow this? There's not a lot of evidence for it yet, right? So if you say, oh, let's wait when we get the data and then we act, it could spell doom, right? So you have to be proactive. But then that means that the wrong bets could stifle innovation. So regulators need to have that sense of understanding that, look, it's not easy, but you have to strike that balance. Make sure you're protecting lives, but then you are not stifling innovation. Don't make it impossible for young people to build solutions for healthcare or for any other field for that matter, because the reality is that innovation is usually driven by young people, right? All the major technologies that we are relying on today, the laptop I'm using came from a company that was built originally by people who were in their early 20s, right? The phones we use, the companies we admire, Apple, Google, Facebook, all of them were started by early 20-year-olds, right? The likelihood of someone being 80 years old and gaining all the knowledge and then coming to innovate is unlikely. That's not usually what happens. And for young people, if you make it so that it takes 10 years to get started, it's usually a good way to make a lot of them lose interest. So having, like, let's say, regulatory sandboxes is one of the ways to overcome that. So make provision that says that, hey, our regulation might be complex, but this is a sandbox. Come to us, work within the sandbox, test your ideas, improve your ideas, and then we walk you through going from that to now something that can be used in the real world. Having some of those provisions are essential to ensuring that innovation is kept and grown, but then also you're still protecting lives. But also, to some degree, especially if you want to be an entrepreneur, the onus lies on you. An entrepreneur is quite a lonely journey of you having to figure things out and not having someone handhold you. So no matter how complex the regulation is, I mean, it's easier now. Like Moremi is a large language model, right? You could basically ask it to help you interpret health regulations. You could pass a document and help you regulate. When I started, I didn't have that. I had to go pick up FDA, Ghana's regulatory requirement and read the entire thing, which was complex, right? Now it's easier. You can have AI systems help break down some of those things for you. And then we've met with health regulators through African Union. These are some of the things that we're also discussing with them, leveraging AI to make it easier to regulate and then make it easier for people within your ecosystem to understand your regulation. So there's a lot of evolution that is happening now. Yeah.
You highlighted the importance of not stifling innovation and how it is driven by mainly young people. So, are there any AI trends or innovations that you're seeing in Africa at the moment that you're excited about?
Yeah, generative AI is massive globally, and I see a lot of young people upskilling themselves in generative AI too as well. When we started working on generative AI, this will be 2022. Basically, this is when ChatGPT came out, and that was about the only generative AI product that existed. And so we had to learn everything from scratch. And because ChatGPT, OpenAI was hiding essentially all the information for proprietary reasons. There was very little you could learn. So you had to learn a lot of things from first principles, from trial and error. It's gotten easier now. So it's good to see that the AI community in Africa did not stagnate. It did not say that, oh, yeah, we're already doing predictive AI. This Gen AI stuff does not concern us. No, no, no. A bunch of young people started learning how to do generative AI too. So when we're hiring, let's say 2022, 2023, even to some degree 2024, a lot of the candidates we got had no knowledge of Gen AI. So we just picked the smartest people, give them a lot of materials, and then walk them through it to basically get to a point where they can do Gen AI. But this year around when we are hiring, we see a lot of young people come in. They're like, oh, yeah, I did some LLM project myself. I fine-tuned a small model. I did some retrieval augmented generation project. So there's already that trend of upskilling, which is usually not the case, right? In the past, what happens is some new technology exists in the West, and then it takes Africa like 10 years to catch up. But now we're in an era where if it emerges anywhere, young people are ready to quickly adopt and then evolve.
Thank you for sharing that. So, look into the future. Where do you see minoHealth AI labs, say, in the next 5 to 10 years?
Yeah, so basically, a lot of the initiatives that we have now would have fully matured by then, especially the government partnerships, right? So in 5 years, we should have nationwide scale up in quite a number of countries, in quite a number of continents, right? So I'm really looking forward towards that, where basically you can see these are the number of countries that every single public institution is running our AI system, or majority of them are running our AI system to just ensure that lives are being saved. That scale up is necessary. Currently, yes, we have users in over 50 countries around the world. Our AI system has generated and processed several tens of millions of tokens. I think we are somewhere like 50 or 80 million tokens. But then a lot of the need sits within the public sector, right? Especially in rural areas away from urban areas. So we are in the phase of getting into those spaces. And so the massive scale up that we are currently working on within those spaces in 5 years, it should fully mature across several countries. So I'm very much excited about that. But also in biology, so I mentioned we are designing drugs. We now basically have what I would say arguably is the most powerful AI drug designing system in the world. Right. So basically, you can just tell the AI system in plain English that I want a new drug for cancer. I want a new drug for malaria. Or you can be more specific. You can say, I want a monoclonal antibody targeting the AMA1-RON2 complex. And the AI system will reason through that, come up with different ideas, and then run in silico validation all by itself without any human in the loop. Just tell it what you want, how many candidates you want, we'll do all of that and rank it. And then we've partnered with biolabs to actually take this work and then translate them into or do wet lab analysis to validate them. And so in 5 years, we should see some of this mature and potentially we could be close to a drug. Best case scenario, we actually have a drug by then. One of the drugs that we've currently designed with an AI system already getting regulatory approval by that time, or at least in the process of it. Because our goal, making a drug currently takes about 13 years and can cost you like $4 billion, a very expensive long journey. We want to slash that by a lot by leveraging our AI system. So in 5 years, as we scale that up, there's a potential that at least one of our potential candidates is either through the regulatory or clinical trial or has already gone through it. But yeah, those are some of the things I'm looking forward to, but also the technology. So by then, I expect we would have successfully built AGI, Artificial General Intelligence for Healthcare Biology, which means that Moremi, or what we decide to call the AI by then, is several folds more powerful. Basically, it can do anything that is done in a hospital with accuracy that is almost superhuman. That is what we are going for. Yeah.
Fantastic. So looking wider in the next 5 to 10 years, where do you see Africa in the global AI healthcare space?
We should be leading it. That's our interest, right? So at minoHealth AI Labs, like I mentioned, even now, we very much prioritize we getting partnerships, and especially on the implementation and in different parts of the world. And so in 5, 10 years, we want minoHealth to be seen as the face of healthcare, not the face of AI for healthcare. The reason why we went for the general purpose AI system doing everything in healthcare is that we want our AI system in all aspects of healthcare. I've talked about biology, healthcare, but even we are doing the administrative end. So we have like healthcare CRM systems. If you want an AI system to call your patient to remind them to refill their medication or to remind them of the appointment, all of those things. So we want to sit across the healthcare and become basically the global leader, the biggest company in healthcare globally. So 5 to 10 years, that's where I hope we get to. And of course, that should be an ecosystem effort. Like, definitely we want to be the leader, but we want that to spur a lot of inspiration and then start a bunch of other companies within the space of healthcare, AI for health, biotech within Africa that also go globally and are seen as global leaders too. Yes.
Quote of the week.
As people, we often have quotes, mantras, proverbs, or affirmations that keep us going when times are good or when times are challenging. Do you have one that you can share with us today?
Well, I have a couple. So I just came back from South Africa, right? So I was honored enough to be featured on the Forbes 30 and the 30 list.
Brilliant.
Thank you. So they asked a similar question, like, what is your quote, right? When the news broke out, it was like all these messages and everyone reaching out, flooding all over. And there was only one quote that kept ringing in my head. The quote was, the days are long, but the years are short, right? I can remember the very, very painful moment along this journey, right? I mentioned how basically what I thought would have been 7 months became 7 years. That was not easy to do. There were disappointment on the journey. There was so much pain and all of that. And there were days that I felt they were too much. There were days that I could just be like, you know what? I'm tapping out. I'm going to sleep because staying awake is too frustrating. Let me sleep and wake up and see if I feel differently, right? So the days can be super long. But the next thing you know, 7 years is gone, 10 years is already gone. And then what you were working on has now matured into something else entirely. Right. So it's a reminder that like you need to grind, and then it's painful in the moment and everything. And it feels so slow. You feel like, okay, we are not moving as fast as we did. But the next thing you know, several years have passed by and so much has happened, so much growth and development has happened. So that's one of my favorite quotes. The days are long, but the years are short.
I like that one. Thank you for sharing it with us. And what a perfect note to end today's conversation, Darlington. Thank you for sharing your journey and insights with us, and also showing us how innovation can bridge that gap between healthcare and also inspire the new generation of African innovators. So yeah, absolute pleasure. And it's been great having you on the podcast.
Thank you for having me.
Thank you to everyone who has listened and stayed tuned to the podcast. If you've enjoyed this episode, please subscribe, share, or tell a friend about it. You can also rate, review us in Apple Podcasts or wherever you download your podcast. Thank you, and see you next week for the Unlocking Africa podcast.